More than half the population will be diagnosed with a mental illness or disorder at some point in their lifetime, according to the CDC. But there is a shortage of mental health care professionals. News Channel 6's Ashley Osborne spoke with the Medical College of Georgia about how they are addressing the gap between those seeking treatment and those providing it.
Psychiatry resident Dr. Nora Asali looked for a place to volunteer. She said she found resources in our community, but didn't find a free clinic dedicated specifically to mental health. So she decided to start one here. Every last Thursday of the month from 6 to 8 p.m., they'll help those struggling with mental illness. An attending psychiatrist will oversee residents like Dr. Asali as they conduct evaluations.
For different disorders like depression or anxiety, so we'd be asking the patient questions to see if they experience symptoms that would, meet that criteria, and we just kind of go through the interview to see what disorders they might meet criteria for and then see what the appropriate treatment for that is.
Often the right treatment includes medication, so they're fundraising to help patients cover that cost as well.
Of course, because we're a free clinic, we don't have enough funds currently, which is why we're fundraising for that. One of our psychiatry attendings here, Dr. Rosenquist, is playing a benefit concert for us.
They've got more information on the concert, plus other ways you can donate and get involved on their Facebook page, which we have linked on WJBF.com. Students like Emily Moore are working on the fundraising efforts and will help run the clinic.
I have always been really interested in mental health because it's kind of like the less tangible side of medicine, and I think that because of that it can sometimes be hard to seek treatment for it, find treatment for it.
For many, mental health treatment seems like a luxury they can't afford or can't access. These young doctors and future doctors are trying to change that.
For something as common as depression, for example, treatment is life-saving.
The free mental health clinic is for those who are uninsured or underinsured and at or below 200% of the federal poverty line. They accept walk-ins, and their first clinic is this Thursday at the Stoney Building. In Augusta, Ashley Osborne, WJBF News Channel 6.